Hello class, my name is Jonquilla Holt and this is my lesson plan on the management and prevention of hypertension in the Shadowville community for Nurse 44L. Lesson goal and objectives. The goal is for learners to identify risk factors, management strategies, and treatments for hypertension. Objective 1 is to explain hypertension and the risk factors. Objective 2 is to give 3 examples of ways to manage and prevent hypertension. And objective 3 is to demonstrate blood pressure monitoring and the importance of medication adherence. What is hypertension? Hypertension is high blood pressure that occurs when the force of blood against the artery walls is consistently too high. Our normal blood pressure is anything less than 120/80 milligrams of mercury. Elevated is 120 to 129 over less than 80. Stage 1 is 130 to 139 over 80 to 89. And stage 2 is greater than 140 over greater than 90. Hypertensive emergency is anything greater than 180 over 120. Common risk factors for hypertension include diets that are high in sodium, obesity, having a sedentary lifestyle, smoking, age, family history, and sex. Males have a higher risk than females until after menopause. Managing and preventing hypertension. Prevention and management strategies include regular blood pressure monitoring, 30 minutes of physical activity daily, reducing sodium intake, eating a balanced diet, attending medical appointments, and medication adherence. Common blood pressure medications are ACE inhibitors, beta blockers, and calcium channel blockers. Checking your blood pressure at home. You want to avoid eating, exercising, talking, taking any medications, or drinking any caffeine 30 minutes before you take your blood pressure. You want to also make sure that you have an empty bladder. You want to sit quietly for about 5 minutes prior to taking your blood pressure. You want to hold your hand at the heart level with your palms up, and make sure that you have a blood pressure cuff that fits your arm and that is in the correct position. Monitoring and medication adherence. Key points. How to measure your blood pressure at home. Again, cuff at the heart level and at a seated position. Take your medication exactly as prescribed by your provider. Consequences to non-adherence of blood pressure medications is kidney disease, hypertension, or possible stroke, heart attacks. Evaluation questions. Define hypertension in your own words. Number 2, name 3 risk factors for high blood pressure. Number 3, how much physical activity is recommended daily to reduce hypertension risk? Number 4, what is 2 medications for hypertension? And number 5, what is the importance of taking your prescribed medication? Thank you for your time and have a great day.